Dr. Kent Chamberlin. And Dr. Chamberlin received his PhD from Ohio University, specializing in computational electromagnetics. His research has been devoted to modeling radio wave propagation, including interfering radiation from computing devices and wave phenomena in the human body. Dr. Chamberlin is the past chair and professor emeritus in the Department of Electrical and Computer Engineering, and he's currently a founder in a high-tech startup company. In his more than 35 years in academia, he's performed research for more than 25 sponsors, including the National Science Foundation. He's received 2 Fulbright Awards, including the prestigious Fulbright Distinguished Chair, which he served in Aveiro, Portugal. He's also served as an associate editor for the Institute of Electrical and Electronics Engineers, and he continues to be active in performing research and publishing.
First of all, I'm very much into technology, as you could hear from the introduction. And so I'm not here to get rid of technology. This isn't a gloom and doom presentation. Yeah, there are some clearly identified problems, health problems associated with exposure to fields, but we know how to fix them. We can fix them. When engineers were told to build these systems, they were never told to minimize radiation. The assumption at that point was that radiation was completely harmless. It's not, and I want to say a little bit about that because I want to let you know why you might want to fight the rollout of installations in your city because of that harm. So let me kind of go to what I need to go to get that point across. Also, I should let you know that I'm not here presenting my own opinions or findings. I'm here to share with you the results of a commission, a state commission, and I'll say more about that commission and how it was formed and why it's important. So at this point, I'm going to share my slides, hoping that I can do that. And at this point, I'm hopeful that you can see my slides. Oops, I'm not hearing anything. Jonathan, can you see them?
I can see them.
Fantastic, thanks. And that I shouldn't need feedback after this. So as you can see on the slide, the commission I served on was I got to learn that, through bipartisan legislation, and it was created to answer questions about the effects of wireless radiation exposure, which includes all generations of cell phones and cell towers. So the reason for this is that legislators were being told by the telecommunications lobbyists that such radiation exposure was completely harmless, while some of their constituents were reporting exposure was harming them. There's also scientific evidence showing harm, so legislators decided the best way to find out what the truth was to form an independent and unbiased commission. The legislation that formed the commission, which is House Bill 522, it's linked in the slide, which passed both houses of the legislature and was signed by the Republican governor, and it was clear in describing the questions that the commission was supposed to answer and the expertise needed to answer them. So I should note that I'm including hyperlinks in my slides and that I will be making them available to you. Oops, I got to admit people now that I'm the host. And so once you get these slides, you can simply click on them and it'll bring you to the reference that I'm making in that slide, including the legislation. As you can see, we ended up with people with the expertise you would expect to be able to answer the questions that we were being asked. In other words, what's really going on with health and with exposure to electromagnetic fields? So we brought in experts, and you can see who those experts were. We had a couple of physicians, we had a physicist, toxicology, electromagnetics, epidemiology, etc. And I was asked to serve on the committee because of my background in radio frequency and biomedical engineering. The key point is that none of us were paid for our participation and none were affiliated with the telecommunications industry except those members who were brought in to represent that industry. After all, we needed to have their input in order to make a fair and unbiased decision. I want to go through a little bit of the process here. I don't want to dwell on it, but I do want to let you know what the commission went through in order to come up with the conclusions that I'm going to tell you about. And I kind of told you that already. And Scott already said what some of those decisions or those conclusions were. So we did a scientific review of the publications. I was very much involved in that, in reading that. And frankly, I got to say that when we started this study, when I was asked to join the commission, I didn't think there was any harm from low-level wireless radiation. I was told maybe you shouldn't have your phone right next to your head. But besides that, the conventional wisdom in our discipline was that this low-level radiation was pretty much harmless. So that was the long-held conventional wisdom. Didn't take very long, though, in studying and going through the literature to find many articles documenting even low-level exposure can be harmful, particularly long-term exposure. So one claim, I'm assuming that you have heard from people from the telecommunications industry, you've heard from people who are promoting the rollout of wireless facilities in your town. So one claim you may have heard from those people is that the only articles showing harm from wireless radiation exposure are those from what they call fringe journals. Now, I'm familiar with low-quality journals, which is what I assume they mean by fringe. As a former associate editor for a major scientific journal and as the former chair of a high-tech academic department, I'm familiar with ways to determine the quality of a journal. And I can go into some of the detail about how I can determine that quality, but the bottom line is I can assure you that the information the commission used was from high-quality publications, and that's what we used. So we did a lot of looking in the peer-reviewed science. We looked at the quality of the journals, and if they didn't meet our standards, we didn't use them, but we did draw our conclusions from looking at lots and lots of high-quality peer-reviewed journals. Another claim made by the telecommunications industry is that journal papers showing harm from wireless radiation are what they call cherry-picked. The suggestion is that most studies do not show harm, and that only the few that do are presented as evidence of harm. Unfortunately, this erroneous claim can be easily refuted by analyzing the findings of papers from credible journals to determine whether they do or do not show harm. One such analysis was performed by Dr. Henry Lai at the University of Washington, and that analysis shows that over 90% of the papers, over 90%, show oxidative stress as a result of wireless radiation exposure. So I would like to summarize the last two bullets on this slide. And the first is that there are many publications in high-quality journals that show harm from wireless radiation exposure. The second is that such publications are not in the minority. They are in the majority. Given this, if anyone, like the representatives from the telecom industry, if anyone tells you that low-level wireless radiation is harmless, they are either woefully misinformed or, putting it politely, they are not being truthful. So I do want to say a little bit more, moving along and talking about the major harm-causing effects of wireless radiation, and that is oxidative stress. So I'll say a few words about it. That stress can lead to the creation of free radicals, and I'm assuming most of you have heard about free radicals. Studies show that cell mitochondria are affected by even low-level radiation exposure, and that causes free radicals to form during the production of ATP. Don't mean to get too nerdy on you, but I wanted to show that there is a known mechanism for causing problems. You may know that free radicals lead to chronic illnesses, such as the ones shown on the slide, such as Alzheimer's disease and diabetes. And you know that these illnesses have increased significantly since the rollout of wireless communications in the United States. Now, I'll be saying more about that later, but I've put in hyperlinks to the diseases so you can look at some of the peer-reviewed articles and the ones that describe the association between those diseases and wireless radiation exposure. There are thousands of articles, and we looked at hundreds of them in the commission, but I'm only able to do a little bit of linking on this slide here. Just returning to the activities of the commission, we did write our final report, and it was in November, 2 years ago, November of 2020, and you can read it. It's linked right here, and so you don't have to read the entire report. It's 390 pages, but you really can get a gist of what we were saying, what our conclusions were by reading the first 17 pages. It's also worth noting, since I'm talking about the process from the commission, that 9 of the we brought in not experts to talk to us, to provide us with insights, to share their knowledge about wireless radiation. And only one of them claimed, only one of the 9 experts that we were brought in claimed that wireless radiation is harmless. And that was the one expert brought in by the telecommunications industry. And that expert was the only one who was paid to present. All of the other experts, the ones who weren't paid, reported that there is harm from wireless radiation. And here's something else I think you need to know. It's very important, and that is about the FCC exposure limits that are being used right now, and in fact, we're being exposed to them right now. So it became clear to the Commission early on that the FCC exposure limits currently in place are completely inadequate to protect people and the environment. It's not only people that get affected, it's the environment as well. So we decided how those limits had been established. We found that those limits were set in the 1980s and were based on short-term, around an hour, behavioral studies on rats and monkeys. You see, the assumption with these limits is that if a radiated signal is not strong enough to warm tissues, it will not cause harm. An example of waves warming your tissues is the microwave oven, and clearly that amount of heating can cause harm in the short term. So going back to the study, the animals in the study had been trained to push a lever to receive food, and they were food deprived at the onset of the study. They were then exposed to increasing levels of radiation until they could no longer perform the task of pushing the lever. That radiation level was designated as the upper exposure limit. And then a safety factor of 50, they divided that upper limit by 50, and that was applied to come up with guidelines for the general public, and that's the limit that's being used today. The limits that the FCC used came from an hour-long study on rats and monkeys, and it just exposed them to the point where they couldn't perform a simple task. So obviously, a study conducted in an hour cannot assess the long-term exposures, such as what we're exposed to 24/7. I mean, it's like having a group of people smoke a pack of cigarettes each and then proclaiming that cigarettes are safe if they all survive, which they probably would. So clearly, these radiation limits are ridiculously outdated. So we tried repeatedly to get the FCC to come and talk with us, but they wouldn't, and they never showed up anybody and sent anybody. We also asked the other lettered agencies, such as the FDA and the EPA, but they never came either. Now, a reason that some government agencies are not responsive to the public can be explained by the fact that they are captured by the industries they're supposed to regulate. The case of the FCC being captured is explained in the Harvard University report linked here, and it makes for good reading. It provides an explanation as to why wireless limits have not changed in more than 26 years, even though they've been successfully challenged in court. And you'll hear more about this from Theodora Scorato, who will be speaking next. The reason that industry wants to keep these high limits, as you can guess, is money. It would cost a lot of money to do things correctly. To do them the way they're doing it, and I could go into great detail about that. To do it the way they're doing it is relatively inexpensive. To do it right costs a lot of money. So, again, trying to go a little bit quickly here. If you're not familiar with what some of the immediate effects of wireless radiation can look like, I offer the following. And this particular example comes to us from California, although there are a large number of other examples that I could have used, including your neighbors in Pittsfield. In the California case, the towers were placed on or near fire stations, which makes sense logistically because of coverage area, easy access, availability of utilities, etc. And if the radiation from these facilities was not injurious to health, this placement would be ideal from an engineering perspective, but as I've mentioned in the past few slides, radiation does negatively impact health, and the firefighters were exposed continuously during the time in the station. I should note that the maximum power output from the towers measured inside the fire station was only 5% of the FCC guidelines, but as I just mentioned, those guidelines are really kind of meaningless in terms of being protective. I'm using the firefighter case as an example because we generally think of firefighters as being robust physically and as being the last ones to complain. So when firefighters do complain, we should take them seriously. So what happened after the cell towers were turned on? I'll read directly from the slide. Within a week of installation, many firefighters developed unusual symptoms of headaches, fatigue, insomnia, memory loss, confusion, nausea, and weakness. After a time, firefighters in stations with adjacent cell towers were found to have forgotten CPR or became lost responding to a fire in a city they grew up in. So for those of you who are familiar with what's going on in Pittsfield, you'll recognize these symptoms as being the same ones reported by the people living near the Verizon Tower. So what's being reported to you here is not an anomaly. It's not psychosomatic. I've heard industry representatives claim that it's all in their heads regarding people reporting such symptoms, but that claim is readily refuted by science, as is shown on the next slide. And obviously, I don't have time to go into detail about this, but what this slide references is one scientific study. There have been many on neuropsychiatric effects due to radiation exposure. In this case, people were, sham exposed or not exposed or exposed, and their symptoms were monitored. So there's no way that they could be faking it. So this rules out the claim that it's all in their head. And so what's also significant is the symptoms identified in the scientific studies, which you can read right here, they'll match those symptoms of firefighters and the people in Pittsfield, or a lot of people who are exposed. And just a point to make, which I get with this slide sometimes, clearly there are a number of causes for the symptoms listed in the article. For example, you can get insomnia for drinking too much coffee, and you can get headaches from drinking too much wine. But many of these symptoms are as a result of wireless radiation. And even if we don't experience these particular symptoms due to exposure, we still experience oxidation when we are exposed. That's the premature aging. That's the diseases that can result from oxidative stress. So I'd like to quickly now go on to what we're trying to do here in New Hampshire. And many municipalities, and this is what Scott was saying, have enacted meaningful protective ordinances. What we're trying to do is enact ordinances here at the state level. And our original legislation included that 500-meter setback. Also, I got called for a registry so people could report radiation sickness. Neither of those were lasted is going through the legislative process, because the committee that looked at our legislation said that this is not going to make it through the full legislature. We have to pare back, but still, we agree with you guys. There is a problem, and they voted 15-3 in favor of us writing legislation that would be protective and would still pass the legislature. If you want to know more about some of this, I have a listing of 38 epidemiological studies that show what happens to people who live near cell towers. And the vast majority of those studies show adverse health effects. You don't want to live near a cell tower. And the second link, which I'd recommend, describes the rationale used by the New Hampshire Commission to come up with that 500-meter setback. We did it a couple of different ways, but we came up with a strong rationale for why you should set back new towers. Now, before I conclude, I'd like to share two slides with you. My intention is to bring the findings of the New Hampshire Commission a little bit closer to home. Specifically, if you're thinking that the negative effects of wireless radiation only happen to other people and in other communities, I'd like you to consider the following. As you can see, this is the Alzheimer's disease rate in this country. And over the last 20 years, it has more than doubled. And I just did search. You can do the same thing, do a search for Alzheimer's rate, and this is what you'll come up with. It just popped up. So I can't say that wireless radiation exposure caused this increase, but I can say that peer-reviewed scientific studies show a mechanism linking wireless exposure and Alzheimer's. Even without those studies, the plot in front of you begs the question about what has caused this dramatic increase. What has changed? What changes have happened since 2000 that could explain the data on this chart? A little pause there. Next, let's consider the Alzheimer's rate, the diabetes rate, which is increasing. So the color coding on this map, which is for 2004, shows the diabetes rate in our country starting with 2004. The light blue scene in most of the country indicates a diabetes rate of between 3.3 and 6.5%. You can read that from the caption there, the color coding for the map. And in other parts of the country, some of the urban areas, you do have a higher rate of diabetes. So let's move forward. We just move forward a couple of years. Moving forward to 2012, we see a marked increase in the diabetes rate for pretty much the entire country. Clearly, something significant is going on for this large change to happen. And it probably isn't simply diet or computer games. One event that did occur between 2004 and 2012 is the introduction of the iPhone, along with the rapid rollout of Wi-Fi in schools. As noted earlier, science has shown an association between wireless radiation exposure and diabetes, just as it has for exposure and Alzheimer's disease. And finally, we can see that the increase continues into 2019. So while I can't definitively claim that wireless radiation exposure is the cause of the disease increases shown on this and previous slides, I think you'll agree that even without reading volumes of scientific journals, we should exercise caution as we consider more radiation sources to our environment. So in conclusion, a formal state commission of unbiased experts formed through a bipartisan legislation concluded that low-level wireless radiation, such as what you get from your cell phone and cell towers, is harmful to human health and the environment. And technological development should be pursued to lessen exposure levels. As I mentioned at the beginning of our presentation, there's a lot that can be done to significantly reduce exposures without preventing you from being disconnected. We can do it. And migration to fiber connections and wired connections will result in much, much faster, more secure, and more environmentally friendly approaches to networking. And as you finalize your ordinances, I strongly encourage you to act on the findings of the New Hampshire Commission. There should be no hurry in deploying new wireless facilities, as there are other very superior alternatives to wireless broadband. And that concludes my presentation. I look forward to entertaining questions when we have the Q&A session.